Can people hear me okay?
Yeah.
Brilliant. Yeah. Fantastic. Well, we might make a start. I'm just seeing the clouds come over on the terrace, so I'm hoping that people are brought in from outside. We're competing with very good weather. Thanks so much for joining us for this discussion. I'm hugely looking forward to it. The first thing is to say is thank you so much to the Impact on Urban Health for kindly supporting this. We can't host these kind of events without organisations like Impact on Urban Health. I think in terms of just setting up the discussion for today, as I'm sure everyone in this room will be aware, progress in improving children and young people's health on too many indicators has stalled or gone into reverse in the last decade. A few examples we know. In the case of obesity, nearly 1 in 4 children are obese by the time they finish primary school, and that number rises to 1 in 3 children in the most deprived areas. Things like oral health, a quarter of 5-year-olds now have tooth decay, and issues with oral health now the biggest reason for children to be admitted to hospital. We know that uptake of key vaccinations, including the 1 in 6 vaccination and the MMR vaccine, are in decline and far below the level recommended by the World Health Organization. And of course, in the case of mental health, we know that almost a quarter of 11 to 16-year-olds now has a probable mental health disorder. Our statutory services to deal with those challenges are struggling to keep up with huge levels of demand. We know there are record waits for children and young people's mental health services, and particularly things like neurodiversity assessment, where people can often face years, multi-year long waits for that support. So, of course, clearly that presents a compelling case for additional investment in those services, but we need to do more than just meet and manage demand. We need to fundamentally shift and rethink the way in which we tackle the wider determinants of health and how we intervene as early as possible when problems emerge. Put simply, we need to start driving the prevention revolution from day one, and that's what we're here to discuss today. We've had some really welcome announcements from the Lib Dems in this area, particularly in the mental health space, but also on oral health, but we want to discuss how we can kind of go further and faster on making sure that children and young people's health is a priority across the political spectrum, particularly in terms of the challenge that now comes to government, particularly in this area, and to discuss those challenges around driving prevention from day one. We have a brilliant panel. So firstly on my left is Danny Chambers, MP. Danny is the Lib Dem spokesperson for mental health and the MP for Winchester. Before joining politics, Danny practiced as a vet. Secondly, on my right over here is Polly Mackenzie. Polly now does a range of different jobs, but you will probably know her as having been previously the Chief Executive of Demos, the cross-party think tank, and also the Deputy Prime Minister's Director of Policy in Number 10 Downing Street. And finally, Laurie Lee, who is the Chief Executive of Guy's and St Thomas's Foundation, which is one of the UK's largest charitable foundations, which supports staff and patients at Guy's, St Thomas's and the Evelina hospitals in South East London, but also works across the board to tackle health inequalities in London and Southwark, but also across the UK and beyond. Laurie previously held senior roles at Care International, at the Bill and Melinda Gates Foundation, and then previously worked as a civil servant. So I'm going to leave it there for my opening remarks. I'm firstly going to pass over to Danny to set the scene.
Well, thank you. Health inequalities is an absolutely fascinating and sometimes heartbreaking subject, especially working in that area with individual people, because what you tend to find with I've got a background in epidemiology, and you look at numbers and statistics, and they're absolutely vital to understand what's really going on and what interventions are going to have a tangible impact. But then when you get down to meeting individual people on the sharp end of those statistics, you realise just how important it is. I guess to try and give a slightly, I can sort of speak from personal experience, just to a slightly different contribution, I guess, is I've done a lot of work in places like India, for example, on rabies control. So it's a disease of poverty, it's a neglected tropical disease. About 60,000 people a year in India die from rabies. And it's primarily from dog bites. So it's 100% fatal if you get bitten. And the reservoir for rabies is dogs. And it's often children maybe children under 15 who get this. Now what's really interesting if you're trying to solve a problem like rabies is that you have to understand the cause and effect of your actions when you're tackling it. So if you decided to kill all the dogs, even though they are the reservoir for the disease, paradoxically human rabies cases go up. And it's because when those dogs are removed, new dogs end up moving into the area to take their place. The population's unstable, they fight each other more likely to bite, and you get more cases of human rabies. And if you actually vaccinate humans, it makes no difference to deaths, because if you have the rabies vaccine, you still need to go and get treatment if you're being bitten, get post-exposure prophylaxis. It costs an average of a month's salary for most Indians. So if you get bitten by a dog, which may or may not have rabies, probably doesn't, do you go to spend a month's salary just in case? Especially a kid, you probably haven't reported being bitten. And it turns out that the most cost-effective way to prevent humans dying from rabies is to vaccinate dogs. If you vaccinate the dogs, you know that those dogs are safe, they keep other dogs out, the population's stable, and if you get 70% of dogs vaccinated, human cases go to zero. Now, as a politician, you could quite easily go, well, you could win an election probably going, people are dying from rabies, the dogs are the cause of the rabies, let's take some tough action, get rid of the dogs, and you'd actually make the problem worse. Or you could say, why are we spending money vaccinating dogs? It's humans that are most important, that's where we should spend the money. And there's 5 times as many people as there are dogs, it costs a lot more money, and human cases just don't change and don't reduce at all. So even if you have no interest at all in animal welfare, the cheapest and most effective intervention is to vaccinate dogs. In Jaipur, where I've been a few times, 85% of dogs vaccinated, and there hasn't been a single human case since 2005. We've got this big global program to try and get 70% of dogs vaccinated by 2030. The reason I come into that is that you have to understand that both the disease itself and the impact of interventions to see who you're affecting, what the balance of your interventions are going to be. And we bring it back to the UK and inequalities. You know, we know that free school meals end up producing a lot of money to the economy if you gave them over a long period of time. If you're going to school hungry, then you're not going to get educational attainment, you're less likely to get a good job, less likely to pay as much tax, more likely to end up in benefits, more likely to have childhood obesity, and more likely to end up in prison. And it costs £52,000 a year to keep someone in prison. And yet apparently we can't afford to give them a free school meal to stop them getting them in the first place. You know, and I took over from an MP who voted twice against free school meals, very vocally, in an effort to save money. And even if you don't care about individuals' outcome, it's still economically better to give the free school meals if you're trying to save money. And mental health, we're talking about specifically as well, there's a lot of qualities of mental health. But, you know, talking about recruiting 20,000 more police, the last government did a lot. When we go out with the police, they say they spend up to 50% of their time dealing with mental health issues. So you're employing, you know, while you're cutting mental health services, so you're employing 20,000 more people to spend half their time dealing badly with mental health issues. Now, even if you don't care about mental health, you invest in mental health, you actually free up the police to actually go and deal with, you know, crimes and the other work they're meant to be doing. So I guess as a roundabout introduction, that's the kind of thinking I want to bring into politics, and I know it's the kind of thing that you guys do, is that you have to understand the problem you're trying to solve, you know, various factors that influence it before you can make a political decision, because sometimes a logical decision, like killing the dogs, the source of the rabies, can actually make the problem worse unless you properly understand it.
Yeah. And I think I want to come back to some points about how you continue to make those arguments about things that might not be the most politically salient, but are the most compelling explanation for a problem in a second. But first I'm going to go to Polly for opening remarks.
Great, thank you. So I mostly try to talk about policy, but then I come to political conferences and it always feels like, often with these events, almost everybody who's come kind of probably agrees on a lot of the policy stuff and is probably a policy expert and frankly knows as much, if not more, than me about some of the details. And so therefore it might be worth thinking about the politics of this. So this is a dark observation, but I'm going to make it. One of the ways in which the United States of America has gone mad is driven by a desire to protect children, right? Now, there's so much about whether it is Pizzagate or the Epstein file, you know, we don't want our politics to adopt that tone, right, context. But it's worth observing how much resonance a story built in the idea of protecting children has, right? It's got so much political force. And so therefore, to me, it's a puzzle, right? That some of the policy ideas that, I know, you know, free school meals, Danny's just talked about it, intervening in the food system so that our kids aren't eating junk food, are still so controversial, right? Actually, protecting kids online. And there may be some civil libertarians in the room, I don't know. And it's really hard to get the regulation of online environments right. But fundamentally, the idea that there might be things that are appropriate for adults that aren't safe or sensible for kids, given the developing state of their brains, is one I think that we could all get behind. And yet somehow the politics of that don't seem to quite work for our age. Why is it that we can't seem to tell a story about child poverty that has political salience and becomes a sort of dominant belief in the nation, and we are still struggling with, you know, the two-child limit? And because people are able to tell a story which is, you shouldn't have kids if you can't afford them, right? That feels like justice to lots and lots of people. And we're not able to tell a story that is, kids shouldn't grow up punished by the circumstances of their birth, that is as strong or not stronger than that story. And I don't know the answer to that question, but it seems to me that a political party needs to find a way to give energy and momentum, whether it's through talking about evidence or probably more likely finding the emotional narratives to tell a different story about the environment that we want our children to grow up in. Because so much of this, Laurie and I were just briefly talking about it before, there are kinds of childhood illnesses or childhood deaths that are a result of genetic conditions or rare cancers. Actually, we're mostly quite good at dealing with those, and we're getting even better, and that's fantastic. But the majority of things that affect our children's health at scale, be it anxiety, mental health conditions, be it obesity, communicable disease, air pollution, they're environmental. And they're things that politics is there to shape and influence. And yet somehow the story of the nanny state is one that we can't seem to counter and actually make the case that the state absolutely should be thinking like a nanny, right? Thinking about the safe and healthy environment for our children to grow up in. And I am afraid I have to leave super early because I'm going to do the Sky show about the Lib Dem conference where I will say lots of nice things about us. But I wonder if I can leave you when I go in 15 minutes or so with that puzzle of how can the Liberal Democrats be part of telling a different story that can actually get momentum for the policy ideas that we can all talk about, like ending child poverty, like free school meals. How can we actually tell a story about vaccinations, right? How is it that we have lost so much ground on vaccinations, and how do we get that story to people who are least likely to trust the state? Sometimes for good reasons and for good historic reasons, but who are most likely to need the interventions of the state to enable our children to grow up healthy.
Brilliant, and I really do want to return to that question. I might throw it over to Danny in a second about how the Lib Dems can tell a different story in this space, but I'll pass over to Laurie for his opening remarks.
Thank you. So, yeah, I agree that most of the big health issues affecting children are entirely preventable and should be prevented. Sebastian, you mentioned a few of the current statistics. I think what's even more alarming in many ways is that lots of them are getting worse. Mental health 50 times worse than just before COVID. That's not very long ago at all, obviously. Childhood obesity and the complications that come from that, also on an upward trend. I think a bit to your challenge though, Polly, child poverty is interesting because that's bobbled around similar amount, between 27 and 33% for the last 30 odd years. So it's gone down or up at different times, but it's been within quite a narrow amount. And I think a bit like you were giving with your example there of people's attitudes to can you afford to have children. There's a very ingrained view in a lot of society that if you're poor, it's probably because you did something wrong. And with that is the most fundamental thing that we have to change. I think there are a few glimmers in what we've been able to do on food on that way. So one of the optimistic things on food, I think, is that we've seen in Southwark the real difference that the free school meals made. But I mean, just squarely on obesity. So regardless of what you think about all of the other evidence around free school meals, Southwark started out doing that really early for primary school children in Southwark because they had the worst obesity rates in London. I think we've got to do something. So in 2013, free school meals for primary kids in Southwark. And we worked with them to measure all sorts of different things about the consequences of that. But as a result of that, over the last 10 years, as the country in general, London in general, has seen obesity rates for kids leaving primary school get worse, Southwark's has improved. And it's improved from a really bad place, so it's still over average. But that policy has meaningfully reduced, and at a time when everyone else's was going up. So against the odds and against the tide, reduced childhood obesity. So, you know, those kinds of policies can make a really big difference. But I think in that broader sense, you talked about taking on junk food, and one of our strategies over the last 10 years has been to say, can we break that link in people's lives, that idea that, you know, if you're poor, you probably deserve to be poor, you probably do something wrong. There was a similar version of this, which is, if you're overweight, it's probably your fault. Even if you're a child, if you're overweight, that's probably your fault. You or your parents have made bad decisions, it's your fault. And we have really worked very hard over the last 10 years to change and break that link. And I think that we've largely done quite well on that now. I think there's a much, much wider understanding that the food system markets really cheap, really poor quality food in a very intense way at the lowest income parts of our community. And that this outcome is not a surprise or a coincidence, all their fault, especially children. How can we say it's their fault? So I think that can give you hope that we can maybe break that bigger link between poverty and outcomes and people too. That said, we definitely want to still go further on food. So the government has announced mandatory reporting of the proportion of its sales that are coming from healthy or unhealthy food. We welcome that. We've been campaigning to get companies to do that voluntarily for a long time. It's good to see the government do it. They've said that in due course they will then set mandatory targets for companies to shift that percentage. We'd like to see that sooner than later. Again, we are lobbying companies directly, including by taking strategic shareholdings in food companies to vote for that at their AGM and say, you're now being transparent about where your profits are coming from, you set targets for moving that. But a thing the next step I'd really like to see is see them being made to be equally transparent about their marketing budgets, because there are big companies out there who say that they really buy into it, they say they're doing the right thing. I'd like to see whether their marketing budget really goes where their mouth is. They haven't been saying that they're willing to do that so far. And we have worked recently with a fantastic youth activist organisation called Bite Back, who started buying up some advertising space around London with a great big advert that said, young activists have bought this advertising hoarding so that big food can't. And it's great, got some great coverage for that, it's really good. And then two of the biggest advertising companies in London started refusing to take that advert. So Global and JC started refusing to take that advert from those young activists because, you know, who else advertises with those companies? The big food companies. So there's another step, I think, to really look into that. And I think one of the reasons why that's a really interesting example when we think about, does the government have any spare money? Does the NHS have any spare money? None of that really costs the government any money at all. They do worry a little bit about food prices going up. But we actually know from polling that people who live in food deserts where there's nothing on offer but junk food know how bad that is for them and their children. They want to see the government take action on that. Yes, obviously, they want to see help with being able to afford the healthier food options. We're doing various innovative things with small companies to do that. Free school meals, which has now been brought in for the families on universal credit, is going to help. Raising the 2-child limit on child benefit would certainly help. Just by the way, I was saying that child poverty has been in that sort of 27 to 33% rate for a long time. So it's about 30 at the moment. lifting the two-child cap on child benefit would bring it back to the 27%. So it's meaningful, and it's one of the best value ways of doing that, but it still leaves 27% of children in child poverty, so there's much more work to do. And so I think that we mustn't feel like there's not enough money to get into this. There are lots of policy interventions that we can do, and then there are some where there is upfront cost, free school meals being one, as Danny said, where the long-term payback does come as well, and that's true of the child benefit one too. And when you think about productivity being the big problem in our economy, and you want every kid to be as well educated as possible, well, making sure they don't live in poverty, making sure they can learn when they're at school, making sure they attend school, it's going to make a huge difference to those things. And so most of that investment is going to either pay off at the end or be very inexpensive for government.
Brilliant. I'm actually going to go back to Polly because I know she has to leave. But I want to actually throw back the question at you about for Lib Dems in particular, how do you make progress in this area? I know flagship agenda for Lib Dems. How do you tell a better story about investment in health?
So I don't know. I mean, it's interesting. The bite back stuff is interesting to me in terms of just fighting back.
Yeah.
Trying to think of a better phrase that wasn't just as if when I was at Demos we did some work on nitrates, which are they at the margin but still cancer carcinogenic things they used to make bacon taste good, well actually make it pink. And the interesting thing about that is first of all that there are ways to do it without nitrates that are just as good, so why don't we just ban them? But also, when you do the polling on it, it's just that sense of people really want the FMCG sector to follow the rules. They want them to be regulated. People, they don't want food to be cheaper. So going after buy one, get one free offers is a bit difficult. And by the way, I think what's interesting about the marketing budget is also the discounts budget, which is a big chunk of the marketing budget and totally part of the go-to-market strategy of any new product launch, is the sense of nobody likes big business. And I sort of with a different hat on, I would probably say it's important for the Lib Dems to be a bit more pro-business, and because nobody else is. But I think you can do that primarily through being pro-free trade and pro-Europe. It's
Pro SMEs as well.
Yeah, it's actually, you sense that big, slightly dodgy companies need to stick by the rules is something that I think you can get really strong campaigns for.
Campaign on sewage.
Yeah, campaign on sewage. Yeah, absolutely. And taking on, again, fraud, like there's huge amounts of online scams. Just a general sense of fighting back with the idea of enforcement and playing by the rules. I think there's a lot there. And then just not being frightened to take on the reform or whoever it is when they are putting our children at risk. Be ruthless. I don't know if you remember the AV referendum campaign. The No to AV campaign had a picture of a premature baby in an incubator, and it said, she needs an incubator, not an expensive electoral system. Now, that turns my stomach because it's a disgusting way to campaign against electoral reform, which everyone knows is perfect and wonderful. But where is that level of ruthlessness when they are putting our children at risk? We're too nice, be less nice. I'm going to go, sorry.
I'll bring in Danny on this point about how do we reframe the narrative, and particularly how do you get the politics on this right?
Well, that's what I've been trying to do since I've been an MP for a year now, and you learn quite quickly that at the moment, because budgets are so stretched and the political environment is meaning that just making an argument to do something because it's the morally right thing to do isn't enough. It has to be cost effective and save money in the long run. And the good news is that a lot of the things we want to do actually do save money in the long run. And a good example, I think, is it's a bit frustrating for us, but we're talking about the overseas development aid budget cuts and the programmes in global public health that are being affected by that, including disease eradication programmes, and they directly affect us here in the UK. And I think and genuinely a lot of these cuts are going to make it more difficult for us to see threats coming, like pandemics, antimicrobial bacteria, and deal with them. And it's going to be more expensive for us to deal with them as well. And what I really try to reframe these things, we know that Reform and the Conservatives are really anti-overseas development, are giving money to foreigners. Well, even if you don't like immigrants and you don't want any immigrants to come here, well, one of the best things you could do would be increase the overseas development budget and make those countries stable, help them deal with climate change, make it less likely that people are going to have a population in flux. And you sort of wonder whether to reframe it. We should call it like, I don't know, roll it into the national security budget or something like that, because then it'll be more palatable to a whole load of tabloid newspapers who don't want you to give money to foreigners, even though it's doing the same work. It's putting the other side of the coin about the motivation for doing it. And we know at the moment there's a lot of talk about woke people, mental health issues, and fake anxiety, taking time off work, and they should just cut their benefits and get them back into work. Well, we know that that's a really, really negative way, a very toxic way of campaigning. But to support people back into work with mental health issues, that maybe it should be called the Back to Work scheme. Let's invest money in getting people back into work, rather than saying let's give people with mental health issues money to take time off work, which is how it's being portrayed at the moment, isn't it? They're the ways you have to reframe them. Is you can do the morally right thing, but frame it in a way that even people who only think about the short-term budget effect can see that it is something beneficial. Is that what you're asking?
I was going to ask a question to Laurie specifically about. Specifically about the money situation. I think it'd be no surprise that there's a kind of there's firstly a tension between how do you unlock investment for the kind of long-term commitments in this space that we call for at the same time as services across health and care, across wider public services, not in a great position financially. But then there's specifically the challenge around investment in children and young people, and how we make that a priority fiscally. How do you do that kind of short-term address the performance crisis whilst also carving out the space for long-term reform?
Yeah, thanks. I think there's a few things that government can think about from that point of view, or a potential government. So one is that I don't think it's right to see this as a zero-sum game with the NHS budget. NHS is not the best placed organisation to do the kind of primary prevention that I'm talking about. So vaccines, which Polly mentioned, obviously that's NHS territory. But things like cleaning up the air, cleaning up the high street from junk food are not NHS jobs, they're for other parts of government. As I pointed out, quite a lot of them are not very expensive, much more about regulation. Obviously you've got to keep an eye on the impact it has on the economy, but not directly very expensive government. Obviously there are some specific things. We hope very much that the 2-child limit on child benefit might be removed in the budget in November. Let's see. That obviously is an investment of money, but in the big scheme of the budget, it's not huge. I mean, it's about 1% of the current welfare and pension budget. To lift 10% of the children in poverty out of poverty, and then have a positive impact on them for the rest of their lives. I mean, just change the trajectory they're on and the contribution they will be able to make to society, to the economy, and also the costs that they won't have to create on the education system, the justice system, and the health system. And then I also think there are many things that the government is going to spend money on anyway. And if it just took more time in a joined up way to say, how are we going to make sure that we're going to do this in a way which is positive for health as opposed to negative for health? You can get some of those benefits without having that to be new money. So housing is a massive factor in people's mental health, physical health, financial health. The government has said it's going to build lots of new houses, making sure that as it does it, those houses are healthy, as well as secure and affordable, but also green, means that that one spend on housing can really help address so many of the different objectives of government. And that is smart spending of government money, where, you know, for every pound you're spending, you're hitting 4 or 5 objectives, and you were going to spend that money anyway. So if you just really stop and think, so that you know, there is live work at the moment about the rules about quality of housing in the private rented sector, new builds, those kinds of things. That's really important. I'll give you an example that's going in the other direction now on air. So in terms of air pollution, is still a really bad source of health. Kills maybe 40,000 people a year. In 2013, the first little girl, 9-year-old Ella Roberta in South East London, actually had air pollution on her death certificate as cause of death. And if you live in an area of high air pollution, you're much more likely to suffer from heart failure, and it's disproportionately people on low incomes who live in those areas. So diesel vans, as deliveries go up, is a massive source of that air pollution, but so are wood burning stoves in houses. Do lots of people have wood burning stoves here? Yeah? Lots of people thought they were doing the green thing, right? Because it's not coal, it's circular, from a climate position, CO2 position, it sounds like the green eco thing to do. From an air pollution and air quality point of view, it's like plugging an HGV truck into your living room, and that goes out into the rest of the atmosphere too. We were hoping the government was going to ban putting wood burning stones in new houses. April this year, they said they weren't going to do that. The new 10-year health plan says they're actually going to consult on that. So there's a real political opportunity there to make sure that, you know, as we build these new houses, we're not just creating new health problems that don't need to be created. So there are very smart things we can do without having to say that everything is unaffordable.
Great. I'm actually going to open up to the floor now for questions. Hopefully our mic issues are better with the roaming mic, the front mics. So we've got a question over here.
Hi, I'm Tora from the Parent Infant Foundation, and I chair the First 1,001 Days movement, which is sort of brings together all the children's charities to focus on what happens in those crucial early months and years. I think early brain development was mentioned earlier, but there hasn't been any comments from the panel so far about supporting families where there's serious, whether it's mental health is the root of it, or poverty, or trauma, or domestic violence, where there are a real sort of need for going and providing support to help families to look after babies properly in those crucial early months and years. Isn't that a missing piece of the jigsaw? We've got great evidence about Sure Start now that over the longer term it particularly helped children from the poorest backgrounds to improve their educational outcomes. Over, the IFS have produced a series of reports now, and so although the government's talking about the best start in life, there hasn't been a commitment of that ilk or to that level. It's a difficult conversation, I think, for us to have as a party, because talking about parenting, talking about supporting families is not comfortable ground, I think, for Liberal Democrats, but I'd just like to encourage you to bring these really crucial early months into view as well, and think about the importance of families and the relationships between parents and carers and babies.
Great. I'd like to get another question as well, and then I'll group them back to Let's question over here. Just
Hi, thanks very much. It's been such an interesting discussion. I'm Olga Chandler from the Mental Health Foundation and thoroughly agree with everything that's been said, and a long-standing policy call of the foundation is that tie us together, we need a cross-government mental health and wellbeing plan that looks at both the social determinants of poor mental health and what can be done in communities for those at highest risk. I'm really pleased as well to hear the talk of the commercial determinants of poor mental health. It's absolutely the case that private companies are coming into our communities. They are opening up gambling shops, fast food outlets, in the online space. Of course, this conference has been largely dominated, and rightly, by the harms that are being done there. But beyond regulation, which is obviously critical, ultimately things in society tend to change when private companies decide that they should do when we get an influx of capital. What can be done to incentivise private companies to put money into addressing the social determinants of health that affect them as much as they do us, in particular thinking about the need for a mentally healthy workforce.
Great. I'm going to start with Danny on those questions. So firstly about how can we get the private sector involved in solving some of these challenges that they have a responsibility for, and secondly on the role of parenting and families, how do we talk about that challenge, and also how do we make sure that parents and families are supported to manage health more effectively?
I think so. First of all, from tomorrow about the first 1,000 days. 1,000 days from conception is fascinating. And that first 1,000 days is a bigger determinant on your health than anything you can do. After that, even now we're trying to make choices to live more healthily. And I told everyone in the previous panel, I've got a stone since I got elected, so I'm trying to lose weight again. But the fact is that my health outcomes were much more determined by the time I was about 2.5 years old than anything I could do going forward. And things like you tend to find that the poorest people are also the most vulnerable to misinformation as well. Not only talking about that, but a particular demographic. And a good example is baby formula companies. It's really not as healthy to baby formula as it is to breast milk. But it's advertised in such a way that you'd think it was positively beneficial. And the law was then changed so that you can't advertise baby formula now, but you can advertise follow-on milk from 6 months on, which is what you use after being weaned, which is branded exactly the same way. I can't tell the difference between follow-on milk and breast milk. Anyone watching that's going to assume that this is a phenomenally healthy product that's giving your baby the very best start in life, and actually some of it is quite detrimental, with tons of sugars in it and other substances. But to make it even worse is that the most expensive ones, we've heard stories of people not eating much themselves to save money so they can buy the more expensive one. But then there's a misunderstanding about how it should be used. So then people are over diluting the expensive ones because they couldn't afford enough of it. So then you're not even giving the right ratio of right nutrition of the baby formula. Then it's a complete and utter disaster. And this is like Laurie touched on before. This is an absolute failure of regulation because these companies are not even breaking the law. And what we know is that when we have large corporations, they will always push the limit to what they're allowed to get away with if they can make money from it. We touched on this before, probably less about poultry companies. It's just a really good example because remember that, and to tie this directly into health food companies who will do the same thing if they can. We all know this story as Lib Dems that water companies paid out 80 billion to shareholders, took on 60 billion of debt, didn't build a single new reservoir in the last 30 years, had leaks and sewage pouring out into the rivers, and gave huge bonuses to their CEOs. None of that was against any law, but they weren't doing anything wrong. That is a failure of regulation. And this is where it has to have really smart regulation to ensure, because these companies, you cannot assume that they will suddenly turn over a new leaf and decide actually their main motivation is the health of everyone.
Laurie, what's it for you on the question of how do we get business in particular involved in solving some of these challenges, but also comments on what about families and parents.
Yeah, I want to definitely come to the question on first 1,000 days first. So totally agree with you about how important it is. So some of the things I've been talking about, if we addressed some of those issues that reduce some of the effects on, for example, brain development, cleaner air being an obvious example. But you're right, in the meantime, there are going to be families that need support during that first 1,000 days. We work with a lot of voluntary and community organisations to provide that kind of support to the family that you give. We've evolved what that looks like over the years to really try and address the needs of that family in the round and the kind of the stresses that make life very difficult within that family. So I don't think it's right to assume that low-income families love their kids any less or are inherently worse parents. They're trying their best in unbelievably difficult circumstances. So if we can alleviate those circumstances, they can make a huge difference. And one of the things that we're just in the very early days of trialling at the moment, so I haven't got any results to share with you at the moment, is we're going to do a test of giving a modest grant to families for that 1,000 days. Cash grant, and see whether that makes a really big difference. So we can report back on that another time. On companies, I mean, look, companies are an important part of the economy. We don't want a society without companies where government's doing everything for us, right? And so there is a role for companies to play, and we have to accept that they're going to play to the incentives that they're given, as Dan is saying, and you were saying. So our job is to make sure those incentives are right. Now, some companies more naturally have some very long-term incentives. So some of the companies that we work with, when I was talking about that shareholder activism earlier, who work with us to do that and put that kind of pressure on big food companies, for example, are things like pension companies, insurance companies, who have that very natural kind of like look a long way ahead and sort of like think, well, if society keeps going in this direction, it's going to be bad for us because we think that far ahead. Not all companies are like that. So other companies, they really do need that regulation, and often a lot of incumbent companies are quite happy that if there is a kind of level of regulation that sets the level playing field, because often they're under a lot more scrutiny than smaller companies who might be able to get away with even more when they kind of feel like they're being undercut. So could we just actually have some clear regulations? And they will match them, but expecting them to do it out of the goodness of their heart when they're being expected to produce profits for shareholders, some of which is all about pension schemes, right? Is not realistic. So regulation is really important, and that, as I said earlier, is a relatively inexpensive thing for government to do. And voluntary regulation, we know, is only going to go so far. You've got to back it up with pressure.
Brilliant. Take another round of questions. Matt back in the check.
Hi, I'm Andrew Jolly. I write about preschool meals and child poverty and sort of things. I just want to pick up Laurie on free school meals and obesity. If I can point people, first of all, to the evaluation of the free school meals pilot impact report, page 3 of that. I'll just read it out so I'm sure of what it says. There was no evidence that free school meal pilot led to significant health benefits during the 2-year pilot. and there was no evidence of any change in children's body mass impact. We've not seen any impact on obesity rates since we've introduced universal free school meals. The other councils who introduced free school meals prior to Southwark, so Newham, Tower Hamlets, Islington, haven't seen any impact on their obesity rates. So my question is, how do we know it's universal free school meals that is having an impact on obesity and not any of the other activities going on around it? How do we know it's a causal factor?
Hello, my name's Katie. I work for the Molly Rose Foundation. We work on online safety and suicide prevention for children under 25. I wanted to pick up on something that you mentioned, Danny, about police. You said that police spend 50% of their time dealing with mental health issues. So this is something that we've noticed when working with bereaved families who kind of have that lived experience side. We're specifically working with a group impacted by suicide forums who some of them received welfare checks undertaken by police, and to put it plainly, incredibly ineffective. You know, they were turning up to do these welfare checks, not knowing why they were there, not knowing any of the background, and not being effective in that role at all. So my question was, how do you think the best way to kind of tackle this issue is? Would you kind of introduce mental health specific police units, or what do you think is the best route?
I'll start with Danny on my question about mental health and then go over to
Sure.
It's a big step back and look at the big picture. We're in a situation where the police spend so much time dealing with mental health issues because people, firstly, are in an environment where they can develop them in the first place, and ideally we want to be in a situation where most people's mental health issues are dealt with before they need clinical services. And at the moment, the NHS mental health services are overstretched. We know that because at A&E, there's a significant proportion of people who turn up in a mental health crisis, having been on a mental health waiting list sometimes for 2 years, and in that time they repeatedly go to A&E. When someone goes into A&E in a mental health crisis, the average amount of time they spend in there is 18 hours, and they often need constant supervision from, often they have they often give the locum nurse that job, giving the constant supervision because they're not always working that clinic, so it's something they can sort of do quite effectively. But that's hugely sort of cost burdensome as well as terrible for the individual. And what we're in a situation now where the police and the A&E departments are the most ineffective and most expensive ways of dealing with people in mental health crisis. And the question is, how do you afford to improve mental health services? Well, part of the answer is we're paying for it anyway, but just in the most expensive part. And if we weren't in a situation where the police and A&E were spending so much of their resources on the mental health crisis, we would be having everything from the support in schools and communities, youth clubs. I spent a lot of time with Winchester Youth Counselling, which is an organisation people can self-refer to. They have to go to a doctor to get to that point, and having talking therapies and just sort of genuine social life and support, because so many of these conditions only arise because of the lack of support and the environment that kids are in. And I don't want to only blame one thing like social media and smartphones, which is huge for kids at the moment, but it's not the only thing. It's not a silver bullet. You can say, well, if we've got those smartphones and everything will be fine. It wouldn't. But it's really hard. Like someone in the last panel I was in, which was with some of you there, it's really hard being a kid at the moment. It's really hard. Kids have always got bullied in school, like all of history. Now you go home and it continues. Even if it's not proper bullying, it's constant interaction. You don't have your social time and then you go home and have time with your family. You wake up in the morning to constant messages and interaction. And eventually you're in a situation where people with undiagnosed autism, undiagnosed ADHD, not getting support that they need, develop mental health issues that they wouldn't have had they been in an environment where they had the right support. And then further down the line, you've got people in prison 4, 5, 6 times as prevalence of ADHD and actually 9 times the prevalence of ADHD of the general population, often undiagnosed. How much of their life journey that led them to end up in prison was partly because they had unmet needs and undiagnosed needs, you know. So a very roundabout answer is the answer isn't just, you know, I don't think there should be a special police unit dealing with mental health, because that is dealing with it at the crisis end, where it should have been stopped upstream, and where it's more cost effective to stop it upstream.
Very different question.
Yeah, thanks for the question on free school meals. So I'll have to talk to you afterwards about the details of that pilot study you're talking about. I think the evidence is clear that child obesity in Southwark has come down over the last 12 years in a way that bucks the trends in other places. And there is good evidence, and we in Southwark are very confident that free school meals have contributed to that. I'm not saying it's the only cause of that. Equally, I don't think that reducing obesity is the only reason to support a universal free school meals policy. It also alleviates costs for low-income families, helps kids concentrate at school. If you do it universally, it can also address stigma between higher and lower income children within the school, and so it has a host of positive benefits for why it's a good policy.
We have time for one more question, and I'll draw things to a close. First hand up over there.
Hi, I'm Lauren. I'm from Young Lives versus Cancer, and as we've noted, cancer in children and young people not primarily preventable, not driven by those factors. But what could be prevented is the wider impacts that has on the child, young person or family's life. For example, financial. When you get a diagnosis of cancer, household income goes down, but additional costs go up. Yet we have a welfare system that's not providing disability benefits until 7 months post-diagnosis. Carers benefits after that, so they're dealing with significant financial implications that can last into later life, that then can also drive impacts on their health outcomes or other wider impacts. So I guess, how do we square the circle of getting a welfare system that supports people who fall into those situations, so it doesn't then cause them further worse outcomes down the line because they haven't had the financial support when they needed it most, against the backdrop of a narrative where disability benefits are a burden and people who are living with disabilities are just lazy and don't want to go to work, when actually some of them are children with unavoidable health conditions and families that need support.
Yeah, it's we've been saying for a long time, because it's really self-evident, is you can't fix the NHS without fixing social care, and that's related to what we're talking about, because it's that wraparound package that you need when someone has an illness. And one thing we're specifically interested in as a mental health spokesperson is not only carers and unpaid carers, and the amount that they actually contribute to the economy for what they're doing, but it's also the mental health strain on carers. And you get to the point where some people, when they're caring for someone with an illness, or particularly is now very common to care for a partner or a parent with dementia and Alzheimer's, which I know from experience can be really, really tough and constant. If you don't have support for that care, whether it's in the form of respite care or people coming in, or just a sort of facilitated social life and support network, you're more likely to have mental health issues yourself, and you're more, and the person being cared for is more likely to end up needing full-time care, you know, that is paid for by the local authority. So it's more cost-effective to help keep people. So we're leaning around something. It's more cost-effective to sort of keep people in the home, in the family unit, and where it's appropriate, either supporting them to work in whatever capacity they can. And you know, one of the problems that the PIP sort of cuts is that most of these, the point of PIP is to enable you to live an independent life, and for many of these people to get to work. And that is the point of it in the first place. And now that's being viewed as some sort of lazy sort of cop-out way, freeloading, when it's literally an independence payment. And if you take away someone's independence, at some point in the probably short to medium term, it'll end up costing the taxpayer more to pick up the pieces of the results of that. So, yeah, and I think that what your charity do is really good. It's really important. If anyone knows about the young cancer, the young children with cancers, it's providing funds for parents who then have to travel for treatment to specialist centres and stay away from home, and all the costs associated with that, which some people really struggle to meet.
Really good comments on welfare.
Yeah, so completely agree with you. In fact, we're very, one of the great things about the Guys and St Thomas Foundation is we both have this Impact on Urban Health programme looking at all these social determinants, but we also work closely with the Guys and St Thomas NHS hospitals. And next year we're going to be opening a new child cancer centre, which combines the sort of cancer expertise of Guys and the children's expertise of the Evelina Children's Hospital in London to produce an absolutely brilliant children's cancer service for the whole of the south east of England. And we already support both the Guys Cancer and the Evelina Centre with some of those welfare issues. I'm sure there's more to look into. So I think you're dead right. But yeah, I mean, providing sort of benefits and money advice to those founders has been something that we've done already. Obviously, that's making the most of the existing policies. You're talking about changing some of those policies as well, which I think is a fair challenge.
Brilliant. Well, I promised to keep to time, so I'm going to say a huge thank you to both Danny and Laurie, and also Polly in her absence, for what I thought was a really brilliant discussion, and a huge thank you also to Impact on Urban Health for their very generous support to make this event happen. So thank you very much. Have a lovely evening, everyone, and enjoy the rest of your conference.